Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. You're watching the Knee to Know Show. For today's episode, we're going to talk about functional knee range of motion. And what we're talking about when we say this is, every individual has a certain range of motion of their knee. So a certain amount that it can straighten and certain amount that it can bend. When we talk about surgery and having knee replacement surgery, there's certain goals that we set for how much range of motion that we want to achieve and work on obtaining after surgery. Now, with functional range of motion, what we're doing is we're looking at activities in your day-to-day life, such as walking, standing up from a chair, going up and down stairs, and we're looking at how much range of motion, so how much knee straightening and how much knee bending is needed for those activities. And what that does is gives us a perspective and gives us a goal when it comes to how much range of motion we want to achieve and get back after surgery. So first of all, someone who has a quote-unquote normal knee. So someone who doesn't have a lot of arthritis, someone who doesn't have joint pain, a typical range of motion would be 0 degrees to 135 or 140 degrees roughly. Of course, everyone's going to vary a little bit too, so that's something to keep in mind with all of these values. There's also, with normal, quote-unquote normal knees, a little bit of hyperextension is very normal, so maybe 5 degrees of hyperextension, so going past that perfectly straight, is also something normal as well. So after knee replacement surgery, our goal is typically, so this can vary some depending on your surgeon, depending on your physical therapist, and of course depending on what's going on with your knee and your presentation and everything of that nature. So typically my goal is from 0 degrees, so obtaining perfectly straight extension, to approximately 120 to 125 degrees of bending. And the reason I set this goal is it allows you to perform basically almost all functional activities that you want in your day-to-day life. So actually somewhere around the range of 115, 117 is actually going to give you more than enough, but I shoot for 120, 125. It's just a more, round value, easy to think about, easy to remember, gives you a little bit of buffer. So that's the target that we set for therapy. So now let's think about, what are some common activities and what range of motion, what amount of bending do you need for those activities? So for example, walking, you need about 65 degrees of knee flexion. For picking up an object from the ground, you need about 70 degrees. For going up and down stairs, you want to get to about 85 or 90 degrees. For standing up from a chair, about 95 degrees. For tying your shoe, so lifting your leg up and tying your shoe from a seated position, you want about 100, 105 degrees of flexion or bending. And to squat down nice and deep or to sit in a cross-legged position, you want about 115 degrees. So as you can see, with a relatively, we'll say, average amount of range of motion, you can really do a lot of functional activities and do those comfortably. So a lot of times people are saying, I want to shoot for the highest I can do. I want to get super high. I want to get to 130 degrees, 140 degrees. I'm only at 110 degrees. What's going on? But the thing to remember is actually they've done some studies, and the average amount of knee flexion or bending after surgery is really around 110, 111 degrees. So if you're in that range, you're really among kind of in the average amount, and you can typically do the majority of things that you normally want to do: walking, stairs, standing up from a chair, things of that nature. Now, if you want to do more, we'll say, kind of out there activities, a little more intense, a little more active, maybe you need a little bit more range of motion. But really, you only need to get up to that 125 degree range, even if you're trying to do those certain activities. After that, getting higher than that, 130, 140, is really just icing on the cake at that point. So if you're in that range of 110, 115, even 105 degrees, you're really in a normal range of motion. You're doing well. You can really be comfortable that you can perform your typical normal daily activities with that range of motion. And you shouldn't have to beat yourself up with that. Of course, you can keep working and trying to improve your range of motion, your knee bending, but don't beat yourself up. Don't worry that you're not making enough progress, because you're really most likely doing well. You're probably in a very normal, typical range. All right, so this has been the Need to Know Show. Again, I'm Dr. Luke Peterson, a physical therapist with the Knee Replacement Therapists, and we were just talking about functional knee range of motion, functional knee straightening and bending. Thank you very much for watching, everyone, and take care.